Okay, in this section of the lecture, I'm going to talk about conditions caused by respiratory disease or injury. We're on page 4. Um, Basically, what we're talking about here is restrictive lung disease. In a restrictive lung disease, you have a decrease in the compliance, which increases the work of breathing. Imagine a balloon, which, with the first time you blow it up, how there is a decrease in compliance. It's really hard to push air against that, and then over time it loosens up and the compliance increases, so that when you blow up the balloon, after the balloon's been blown up for a while and it loses its air, you take a look at it and it's very loses elasticity, but it's much more compliant. But the issue with that increased compliance is then you have an increase in the respiratory rate because you're having to breathe more frequently to get the same amount of oxygen in, but you also have a decrease in the tidal volume. You're breathing in, but you're not getting as much going anywhere, and that's going to diffuse the diffusion of oxygen into the blood, leading to hypoxemia. So that's a restrictive lung disease. Example of that would be an inhalation disorder. So exposure to toxic gases, even oxygen can cause this. Excess oxygen at too high a concentration can lead to this. What happens is, in oxygen toxicity, is an increased exposure to reactive oxygen species or free radicals and free radical damage, causing alveolar and capillary damage, which basically incapacitates the lung. Pneumoconiosis, caused by silica, asbestos, coal, all of those will trigger that chronic inflammation and inflammatory process and cause decrease in the lung compliance. Those symptoms of those would be cough, decrease in tidal volume, and hypoxemia, as I explained before. Allergic alveolitis, also called diffuse interstitial lung disease. It's basically a hypersensitivity reaction, a hypersensitivity pneumonitis, inflammation of the lungs, secondary to exposure to an antigen. And this can be caused, it's amazing, it can be caused by grains, exposure to grains. So people who work, farmers who work around grain elevators, dust, lumberjacks who work in sawmills, I guess they're lumberjacks, people who work in sawmills, exposed to sawdust. Hot tub mist. Hot tub mist can be toxic, interestingly enough, in some situations, not always. Humidifiers, toxic humidifiers, can trigger the release of substances that would cause this hypersensitivity reaction. Animal dust, as I talked about a while back, birds, pigeons, especially. Coffee workers, in coffee processing, not baristas, Starbucks workers, you're safe. And exposure, cheesemakers, I guess, as well. But anything like this which could cause a reaction would create this inflammatory reaction and a restrictive lung issue. We need to talk here about acute respiratory distress syndrome, Ards. There are about 150,000 cases per year, and a high mortality, depending on the age group. In the younger set, they've made strides in terms of decreasing mortality. However, there still is a 30 to 60% mortality rate with acute respiratory distress syndrome because of acute alveolar capillary membrane damage. So there's damage to the alveoli, the alveolar capillary membrane. You can't get oxygen in, and that's a bummer. As a result of that, you have a decrease in the partial pressure of oxygen, again, that causes hypoxemia. Let's see. So this is an inflammatory condition, and the inflammation itself is what is causing the injury. Usually due to an overwhelming sepsis by a severe bacteria, trauma, burns. Burns are commonly cause, significant burns often cause acute respiratory distress syndrome, pneumonia, shock, aspiration. All of these can lead to an acute respiratory injury, inflammatory injury. The issue, as we talked about yesterday, when you damage that alveolar capillary membrane, what happens to blood flow? Shunt, that's correct. So your body shunts blood away from that damaged area to go to areas where the alveoli are healthier and where the oxygen is able to get through, and so there's a loss of oxygenation to those areas, and that causes a very low VQ, ending up in hypoxia, tissue hypoxia. As part of this process, the inflammation, platelets get activated. You get the development of the injury causes the development of thrombi, which can lead to emboli. Get an influx of neutrophils, which cause proteolytic enzymatic damage by of the enzymes, free radical damage, platelet activation, as I mentioned. That increases capillary permeability. It decreases lung compliance, decreases lung compliance and decreases the alveolar ventilation. Also leads to, with the increase in capillary permeability, what leaks through? Fluid, edema, pulmonary congestion, right-sided heart failure, which you'll read about in the other sections of the lecture. Symptoms of ARDS, certainly shortness of breath, marked shortness of breath. And if you follow along in that next slide, the manifestations, you should draw arrows from one to the next. So hyperventilation causing respiratory alkalosis, causing dyspnea. So this is how it goes. As a result of lack of oxygen, we hyperventilate. Hyperventilation then causes a respiratory alkalosis because we're blowing off all of our CO2. And secondary to the respiratory alkalosis, we get further dyspnea and hypoxemia. As a result of that further hypoxemia in the distal tissues, we now have a metabolic issue. We have an increase in our metabolic acids, lactic acid, for example. Doesn't get carried away, so you develop a metabolic metabolic acidosis. Because of the metabolic acidosis, your lungs try to compensate, however the lungs are damaged, and so there is hypoventilation leading to a respiratory acidosis because you can't blow off the CO2 that you're hoping to expel. That causes further hypoxemia, and that leads to hypotension, shock, decreased cardiac output, and eventual death if that's not resolved. So make sure that you are taking a look at that process. Read about that very carefully because that's an important that's important. So on that slide, let's see, acute respiratory, go to the slide where there's the diagram. So it's a little bit difficult to see on maybe if you've printed this, but if you have this up on PowerPoint. So remember that there's some sort of acute insult, pneumonia, aspiration, smoke inhalation, sepsis, etc. That causes this massive release of cytokines, influx of inflammatory cells to the lungs, and those cause damage. They cause damage by release of reactive oxygen species and cytokines, activation of the complement system. All of that causes damage to the lungs. Specifically, it causes damage to type 2 pneumocytes. If you will remember from A&P, type 2 pneumocytes are what are responsible for the development or the release of surfactant. Surfactant holds the lungs open, so you're going to get atelectasis. And with atelectasis, you're going to get shunting and decrease in the lung compliance. So it makes it harder to breathe, puts strain on the right side of the heart. Disruption or damage to the alveolar capillary membrane, microthrombi, causing blood clots that increases pulmonary hypertension, and then also with this massive inflammation, you get fibroblast infiltration, which is going to cause growth. That's going to cause pulmonary fibrosis and decreasing lung compliance and then making the heart work harder. All right, that's a summary of ARDS. To be continued.